Hello and welcome to the Weaponized Body Podcast. As always, I'm your host, Dr. Ryan Hewitt, and today we're going to wrap up the year 2025 with one of my favorite topics and one that has really come to the front line of a lot of discussions when it comes to men's health, and that is testosterone replacement therapy. Concerns with, blood work that are often missed and mismanaged, the common ingredients in testosterone replacement, those types of things. But what I thought is I would bring it all together in one complete guide for anybody who wants to know more about the topic or is on testosterone replacement themselves and wants to do this more intelligently, with more precision, and with better results. So, and here's the thing is there's a lot of men in general that are just being completely ignored when it comes to their testosterone health as well, and a lot of men are clearly struggling with low testosterone. So a lot of these, I think discussions about testosterone have created confusion, a lot of fear, a lot of bad outcomes out there, and a lot of unnecessary damage being blamed on testosterone replacement. So what I found is that the real issue, and a lot of men that have switched over to our weaponized wellness services, they're just being mismanaged. There's no precision to what they're doing, especially there's no comprehensive labs being done where they're looking at other organ systems, helping them with other lifestyle improvements that really can amplify the treatment or even altogether help a lot of men avoid any sort of like medical intervention altogether. So today is not like a pro TRT episode. It's also not an anti TRT episode. This is a truth episode. Misconceptions, flawed research, black box warnings, and why there's so many men flocking to TRT clinics, and some of the pitfalls of these more high volume clinics. And why, in most cases, low testosterone can be caused by lifestyle and metabolic dysfunction and not necessarily aging. So my goal is simple. By the end of this episode, I'll want you to understand what makes sense when it makes sense for TRT, testosterone replacement, and when it doesn't, and why most problems blamed on testosterone are actually problems of poor management of testosterone replacement therapy. So let's jump into the first topic from the top, which is the two types of low T. So we'll start with the basics because most men and actually most doctors don't even understand this part, right? The two types of low T, there's primary, what's called hypogonadism, and secondary hypogonadism. They're both very different problem. The primary variety, you can think of it like this. It's when the testes themselves are the problem, when those aren't working. This is a much less common testosterone problem or gonadal issue, is when the brain is sending the appropriate signals like luteinizing hormone and follicular stimulating hormone, but the testes just are not responding. And common causes of this can be, number one, genetic conditions. Number two, testicular trauma. Anybody who's undergone chemotherapy or radiation, severe, what are called varicoceles, okay, like torsion of the spermatic cords and the vessels in the actual testes themselves, severe infections, and actually like age-related testicular failure, but way later in life. So what you're going to see in labs in a primary hypogonadism situation is you're going to see low T, of course, but you're also going to see an elevation in LH and FSH. So this is, as I mentioned, a less common version. And in most cases, TRT is definitely appropriate earlier here because if the testes aren't working, they're not capable of producing testosterone anymore, then replacement therapy is really the only way you're going to get more sufficient. And number two, the secondary hypogonadism, and this is what we're seeing far more frequently. It's more common form of low testosterone, and this one is the most reversible as well. So this is when the testes are still capable of producing testosterone, but the brain is not sending the appropriate signal. And here are the most common causes. which are overwhelmingly lifestyle and metabolic. So number one is insulin resistance. So this is when your blood sugar starts to become dysregulated. And what happens is your body becomes less and less able to utilize insulin to assist the body in basically absorbing and using carbohydrate. And of course, this comes along with obesity. Obesity is probably the number one cause of low T. So chronic stress being a big factor here as well. I've seen many men with just like loads of chronic stress that are suppressing testosterone. And of course, the prerequisite to poor sleep is overwhelming stress too. So poor sleep is a major, major underrated issue when it comes to causing low testosterone. Sleep apnea is a big issue. Screws up your sleep, screws up your oxygen delivery system, and it lowers testosterone. Excess alcohol clearly can be a problem, which of course feeds into the insulin resistance, obesity, poor sleep epidemic. Certain medications can cause a lower testosterone profile. And here's another one, overtraining and under-recovering. So if you're somebody who isn't prioritizing lifestyle, but you're still training like a monster, you might be suppressing your testosterone because of that. Chronic inflammation. Okay, see, these are all related, right? And what you're going to typically see with labs here is, of course, low testosterone, but low or inappropriately normal LH and FSH. So this one is the one that typically shows up in like 30s, 40s, 50s, where you're seeing a lot of guys start to become symptomatic. And the symptoms, of course, include things like fatigue, low energy, low libido, low confidence, brain fog, that kind of stuff. So, and this is actually where a lot of men should not be rushed into testosterone replacement therapy. And as I mentioned, this is of course, a lot of those chronic disease states that I mentioned or lifestyle issues are fully reversible and ones that you can get great results with if you have a practitioner that you're working with who is going to actually give you some really solid advice and coaching and be able to identify patterns on your lab work to show you how your lifestyle is creating these disease states or these less than optimal physiological states. So the whole age-related testosterone drop thing, yes, testosterone does decline with age, but it's one of the biggest lies out there is that it falls off a cliff, which should not be the case. Healthy aging men, they don't lose like 40 to 60% of their testosterone. It doesn't naturally fall off a cliff like that. It's mostly because of these metabolic disease states. So today people are sleeping way, way worse. They're moving their bodies less. They're eating more toxic and deficient foods. They're carrying more visceral fat around their midline. They're drinking more alcohol, and chronic stress loads are as high as they've ever been. So low testosterone being part of normal aging is not the truth. It's low testosterone is more of like a biomarker of poor health, similarly to things like hemoglobin A1C or your cholesterol profiles. These things are indications of a metabolic dysfunction going on with your body. And when we normalize this decline, sort of like we've normalized some of our like ranges, which some of our ranges of quote unquote health are just laughable. So in a lot of cases, this is definitely not the truth. You're definitely sagging. Things are less than optimal. They're dysfunctional. And we just have to identify, without fear, more with education, and just to help people identify these things and how they're contributing to their symptoms, right? Now, I've discovered that the reason that there are so many doctors that do not offer TRT, there's very few primary care professionals that are comfortable offering this. There's even very few urologists, endocrinologists that offer testosterone replacement. And even when they do, it's an uncommon practice for them. So they're not giving solid recommendations as far as like a hormone replacement regimen, right? And education, fear, and incentives are behind this, right? Most physicians what I've learned, they receive almost no training in hormone optimization. Okay. Testosterone is framed as like an optional or cosmetic, or even worse, dangerous. So, yes, you should be very concerned with giving somebody testosterone replacement if they already have an active form of cancer. By no means am I saying that's a good idea. But we need better controlled studies on men with low T and the outcomes that are possible with this without raising prostate-specific antigen, without creating any disease states. So and the thing is, it's all about the dosing to get you in a natural physiological range. That's what testosterone replacement therapy is, or testosterone optimization therapy, I like to call it. It is not the same as getting people into supra-physiological dosing so that they are, getting all these androgens in their body to build, let's say, unhealthy amounts of muscle, or like unnatural amounts of muscle is usually the goal. And even then, the management of the testosterone is usually less than optimal. And here's the thing is, we're not even getting proper workups to even find out, like, oh, your testosterone's low. Okay, well, what are we basing our understanding of why that is happening on, right? So there's no free testosterone levels typically measured, no sex hormone binding globulin levels, no estradiol being measured. Even in a lot of cases, like insulin levels, fasting insulin, A1Cs, ferritin levels, and all these things that are really important to get a stronger picture of what this individual is actually experiencing as like a physiological state, right? But when it comes to testosterone, we've just accepted this as truth. So these black box warnings are based on like abuse models and on sick patients, and not on therapeutic replacement doses. So what we've discovered in more modern medicine, and especially in a lot of clinical practice, is that properly dosed TRT doesn't cause cardiovascular disease, it doesn't cause prostate cancer, and untreated low testosterone is actually more so related to a lot of causes of mortality. So it's correlated with increased mortality to have low testosterone. So testosterone is not the villain in this case. In a lot of ways, the poor application of it is, or the ignorance of actually knowing someone's testosterone levels is. Now, this has led to a lot of men flocking to testosterone clinics. So they weren't getting comprehensive labs. They weren't getting proper check-ins and dosage schedules that made sense, that actually got them into an appropriate range. It's because it's a volume issue, right? So a lot of places, they're based on getting high volume of people through their door, and just trying to make money. So this a lot of people are getting the same dose, the same protocol, the same injection schedule, the same prescriptions for aromatase inhibitors, the same recommendations to donate blood every quarter. And that's not medicine. That's like assembly line hormone therapy. And like the customized medicine thing is just totally thrown out the window here. And let's talk about the pitfalls of that type of practice, right? So number one, and this is what gives testosterone replacement a bad rap, is when you're mismanaging your testosterone replacement, your lipids can go funky. When it's overdosed, or your estrogen is smashed with aromatase inhibitors, this can cause a drop in your good lipids, your HDLs. It can also cause an increase in your LDLs, and increases cardiovascular risk, right? Because it can damage the endothelial lining of your arteries. So when TRT, testosterone replacement, is properly dosed and the lifestyle is addressed, these lipid profiles I've seen often improved, case in point, with my labs personally. Blood pressure is another concern. Testosterone it does increase red blood cell mass and sympathetic tone. The testosterone stimulates a hormone called erythropoietin, EPO, which does increase the production of red blood cells. And here's the thing: if your sodium balance, your hydration, you have sleep apnea, you have cardiovascular issues, you aren't conditioned, blood pressure can be risen. And this is completely avoidable, whether it's like managed through appropriate ARB medications, or even better, just get in shape, drop the unnecessary and unwanted body weight, drink plenty of water, clean up your diet, and you will not have, blood pressure issues if your dosing is correct. Hematocrit and hemoglobin increases. Okay, this comes with that increased red blood cell production. So this is a normal occurrence with testosterone. In fact, people with higher testosterone generally have higher hematocrit values. So this is, in fact, with normal physiologically producing testosterone males. Like if you're someone who is just normally producing high levels of testosterone, your hematocrit's going to be higher. So the body is intelligent; it adapts. And when you have normative physiological levels of testosterone, you're going to adapt by increasing hematocrit and hemoglobin production, which is normal. This is not a problem, in fact. So the response is usually abnormal. We freak out and start dumping blood. And this is problematic because if you routinely dump blood and you're especially not even measuring ferritin, you can become anemic without knowing it. Estrogen is another. Oh, by the way, sleep apnea is also feeds the problem. Okay, because if you have sleep apnea and you're on TRT, right? That is a combo for an increase in that hemoglobin hematocrit to an unnatural state. So addressing the sleep apnea is critical. Estrogen is essential in men. It is an absolute essential hormone. It protects your libido. It protects your mood. It protects your brain, okay, for cognition. It protects your bone health. And very, very importantly, it protects your cardiovascular health. And we get into the habit of using what are called aromatase inhibitors, which are breast cancer drugs. They block estrogen uptake. And what happens, so you've heard of things like Arimidex, and anastrozole. So we use these aromatase inhibitors, so it prevents testosterone to aromatize into estrogen. And what happens is that long terms will destroy your lipid health and increase fracture risk. It can also damage, of course, your cardiovascular health, and it can screw up your libido. So most estrogen problems are dosing problems, okay? They are not estrogen problems. So there's another issue also with TRT is that it can affect fertility, and this is the truth. Exogenous testosterone does shut down natural production of testosterone and your production of sperm. So your FSH and your LH are suppressed. In young men, this is still reversible with secondary hypogonadism that are put on lifelong therapy if you combine with things like clomids and clomiphene or HCGs. Okay, these can increase the production of sperm while on TRT. But here's the thing is a lot of young men, they're not realizing the consequences of being on testosterone replacement. And if you're on it at very high doses for a long time, sometimes, those fertility issues can't be reversed. So the thing is like TRT is down the line step for someone who has low testosterone in their 30s, especially. If you ever want to have children, the whole thing is like, let's look at your comprehensive labs and figure out ways we can increase your production naturally and get you back into a normative state by addressing the 5 levers that I speak about so often, which are stress management, hydration, strength training, protein-based whole food diet, and sleep. Those are, the 5 levers that are under your control, almost 100%. And if fertility matters, TRT should be your last step and not your first. So causes of low T, I think we should talk about those in more detail, because I think these things are minimized, right? And I think that in a lot of cases, because there's so many people that are low T and they're thinking it's just bad luck or bad genes or bad germs, right? But most testosterone suppression these days, number one is from being overweight or obese. We're talking about, You don't even have to be 30% body fat to get a suppression testosterone. If you have excess levels of body fat, like even over 25% body fat as a man, you're going to have early signs of insulin resistance. Sleeping, I think, is, again, this is all part of the same problem. Poor sleep can absolutely contribute to excess body fat and being overweight. If you're not recovering fully, if you're not letting your brain and nervous system fully recover and all your hormonal activities recover, you're not getting a good growth hormone spike in the night. And if your sleep is either interrupted or you're not sleeping enough, this can absolutely contribute to a low testosterone state. Sleep apnea is a big problem we've touched on already. I think alcohol is the other number one. Well, I guess if sleep is number one underrated health condition that contributes to low T, I think alcohol is the second. Alcohol absolutely suppresses your testosterone. It's one of the things that we don't realize that completely it shuts off all of your protein synthesis in your body while you're drinking alcohol, and even the after effects. It will screw up your sleep. It screws up your heart rate variability, increases your resting heart rate. You don't get into those deep and REM sleep cycles that you need for full restoration. And chronic stress. You couple all those together, man, you got a perfect storm for someone who's going to, have low testosterone. And in a lot of cases, if you fix the environment, if you fix the physiology, right, the hormone fixes itself. Now, I get a question, really good question from some people that they've asked me in the past is like, hey, what is a reasonable effort that I should be tackling this natural approach, like before I start considering testosterone replacement? And your age definitely factors into this a lot. But for most men who, let's say, have 10 or 20 pounds to lose, and they've been living by default, let's say, they haven't been sleeping the greatest or putting effort into making sure they get to bed at the same time and get a really sound, restful sleep, do a little stress management work, clean up their diet, get more protein-based whole food, drink more water. You need to give it a good 6-month effort. You need to see some progress at 3 months, but 6 months is what you need to really give it to, lose weight, get into a proper resistance training routine, clean up your sleep, and really start to see some progress with your blood work. And here's the thing: if symptoms keep persisting of low T, and again, like loss of drive, poor focus, low confidence, low energy, poor recovery, if you're seeing like no turnaround in these after 6 months, and you have all the symptoms and the signs of low T, that's when TRT becomes a reasonable approach. Especially if you're in the the secondary hypogonadism. So those symptoms, and then of course, like libido, I didn't mention on that list, is something that actually comes a little later. Testosterone isn't always the first line of therapy when it comes to just increasing libido. Libido is interesting. Testosterone's a big piece of it, but your brain health is a big piece of it too, right? Actually having like normal brain function, right? Being aroused is not just a state of having enough androgen hormone. You need to have proper brain chemistry. You need to have good cardiovascular health too. So blood flow is a big part of getting, hard and erect and maintaining an erection. So, right, more of the low T symptoms that I'm seeing are more of that loss of drive and focus, poor recovery, low energy, and a later symptom can be that dip in libido. So from this whole episode, I hope that you understood that testosterone is not the enemy. In fact, ignoring testosterone isn't something that is noble. It's something that is detrimental to so many men. And on the other side, like rushing someone to TRT is totally reckless. So we're talking about precision medicine, which is the future of healthcare, I believe. Getting properly evaluated, having a comprehensive set of labs done, check your body composition, check your VO2 max, and really get a strong understanding, like a factual understanding of where you are. And if I could, plug anything for the new year, for men out there would be to get a strong foundation of facts for your health in the new year. What is your body fat percentage? What are your comprehensive labs saying, including your hormone health? What is your level of fitness? Okay. Just get some good foundational statistics and data about where you stand. If you desire in 2026 to get more weaponized, right? Have more energy, have better sex, have more confidence, right? Have a better quality of life. That's what this is all about. There are so many resources and so many ways to get healthier these days, right? But it's got to start with the facts. So if you have any more questions about testosterone replacement therapy, if you have any comments, questions, please reach out. Send me a DM at the Weaponized Dad on Instagram. And I really appreciate you guys listening. We're going to do one more episode this year, and getting into the new year. There wasn't a single week that we missed with this podcast this year. I'm really proud to have hit this cadence, and I appreciate all you guys that are listening and not missing any episodes. And I look forward to sharing more in the new year. So have a safe and happy holiday. Please rate, review, and I'll see you guys next time.